Hi everyone, I am Dr.Saritha Prem, Director of Surabhi Ayurvedic Hospital. Today here I am with a new topic, infertility. We know this is one of the very common condition which we can see in our society now, and many of the couples, they are facing lot of difficulties get a peaceful atmosphere in their family and even in the society, because they are getting separated from the other members due to this condition. We know in village areas this condition is really much creating a mental disturbance to all the couples. So because of the continuous arrogance which they get from the relatives, from the society people on. So today I want to explain what are the main causes of female infertility and what is infertility. That is very important to know what is its condition. And also there are some causes, very common conditions which we can see in our clinics. So the reasons for infertility, and what are the diet to be followed, what are the investigations to be conducted in order for the confirmation of the condition, and also what are the possibilities and what all Ayurvedic treatments we can suggest in this condition. So first of all, infertility can be defined. That is, what is infertility? That means a couple or whoever it is who are trying for a conception, when they are not able to conceive or when they are not able to get pregnant even after 1 year of unprotected sexual intercourse. So this is a condition. So after 1 year we consider it as an infertility. We direct them for an infertility treatment. So in here now we know females are facing more difficulties, and their causes are more in the stream of infertility when we check. So some of the common causes which we can see in female infertility are, first of all, PCOS. So we know now this is one of the common cause for infertility in our society. Even we can see all the from youngsters, they are facing this issue of PCOS, PCOD, whatever we see. So PCOS it's a condition where there are multiple more symptoms will be accompanied in this condition. We know polycystic ovarian syndrome or polycystic ovarian disease. So in this condition, the ovaries won't be able to secrete a proper mature egg every month. So the main situation what we face here in this condition is insulin resistance. So the patient will be complaining that they are having irregular periods, and also they are getting facial hair growth, that is hirsutism, and the body weight is getting increased, pimples, all are some of the common symptoms which can see in PCOS. So this is a condition which we can reverse. So with proper medications and also with proper exercise and diet, this condition can be reversed. The next common condition is, we know our hormonal imbalance is one of the very common condition nowadays we can face. That is the main hormones which are responsible for the ovulation and other uterine functions, that is FSH, LH, and also thyroid stimulating hormones. And even the excess amount of prolactin in blood can lead to infertility. And also the lack of certain hormones like anti-Mullerian hormone, which detect the ovarian capacity. So when there is a lack of these hormones also, the lady can face an infertility situation. And there are some other conditions like uterine fibroids. We know fibroids are not cancerous growth. That is the first thing which you have to know. Fibroids are just, it can be in any area of uterus, at the inner wall or posterior. In many areas it happens. It depends upon how we give treatment for that, and also the size of the fibroid is very important in the treatment stream. So there are a lot of medications and treatment procedures to treat fibroids. So that is very important, that fibroids can be symptomatic and asymptomatic. So according to the condition and symptoms, we have to treat the patient in this condition. And the other reasons are we know there are certain conditions which are like malignancy of uterus, that is like sarcomayomas. So such condition, the treatments are definitely possible nowadays. Ladies are having a great fear when they are getting confirmed that they are having some uterine CA. Definitely they used to get more fear. There is no need of fear here, because there are very wonderful treatments in Ayurveda as well, for uterine sarcomas. So in the initial stage, with best medications, they can definitely get a very best result in this condition. And also some cases after for the CA, when they are taking any chemo or radiation, because of the side reaction also fertility can be affected. And the other cause is smoking. So this is a trend now in teenagers also. We can see that smoking is very common, that ladies, it's a style of fashion that they do smoking. So how smoking affect the fertility level, that is also very important. 60% if we consider among the women, the smoking ladies will be definitely facing the condition of infertility, because the nicotine will suppress the folliculogenesis process, and it does definitely impair the estrogen level. So it causes difficulty in the implantation process there. So definitely they will be facing the infertility chances. And the other conditions are endometriosis and adenomyosis, and there are certain typical conditions like in certain conditions like diabetes mellitus, and also celiac diseases, liver diseases, and other situations are this endometrial polyps, or if there is any cervical polyps, cervical stenosis, and very common one of the conditions is cervical dryness is one of the cause, because when the when the vagina secretions are not proper, definitely it will affect the flow of sperm into the fallopian tube. So it can cause chance of proper conception won't happen in that situation. And other situation is premature ovarian failure. So in premature ovarian failure, we know that the ovaries will be unable to produce an egg. And the next condition is hydrosalpingo, so salpingitis or any tubal block. We can see when the tubes are blocked, definitely the egg and sperm won't get won't get connected. So it can happen in many cases. And also when there is any type of growth inside the uterus, like I told you already, endometriosis, because in endometriosis what happens means the inner tissues of endometrial tissues get it grow to the other places, either outside of the uterus or in any other places it grows. So in such conditions, all these fertility can be affected. And also another one condition is anti-sperm antibody. When there are high level of anti-sperm antibodies, it is having a power to kill the good sperms. So this is also one more condition which commonly ladies are facing. So these are some of the very common conditions in female infertility. So how can we confirm it? What are the main criteria to confirm the condition? You can take a USG or transvaginal scan, and even salpingoscopy or MRI scan are some of the investigation methods. It depends upon the situation what is needed. So we can't confirm that all these investigations are needed in everything, because it depends what are the symptoms that lady is developing. According to that only we are going to guide the investigation methods. And also blood investigations are very important in order to confirm the hormonal stability, how it is, hormonal balance, how it is, all these factors. And nextly we will come to diet. So this is very important, that nowadays people are not aware about the diet. They are running behind the fast food and all junk foods. So here junk foods must be strictly avoid intake of sweets like chocolate, all other added sweets, laddu, jalebi, all such sweets you have to avoid. And also definitely you have to take more vegetables, leafy vegetables, and also fresh fruits, nuts, berries. All these things are very much good to promote fertility. intake of garlic is very beneficial in fertility process. So it induces a fertility process, and milk is another drink which you can take when you're concentrating for a fertility. And also try to avoid junk foods like fried items, maida, and also other sweet items and tinned drinks. All these things should be avoided. And another step is that exercise is very important. That in PCOD we used to advise the patients to have a brisk walking. So exercise is one of the very important to be followed here. And also if you know any good yogasanas, you can follow that also. And now we come to the Ayurvedic treatment. So people are wondering whether is there any treatment for infertility in Ayurveda? Definitely. In Ayurveda we call it as Vanditva. So Vandita is considered as a main that treatment is very important here, because what the condition the patient is facing, according to that only the treatments will be directed. There is no common medicines for infertility in Ayurveda. Definitely the physician will be examining the patients, and if she is having PCOD, we will direct the treatment according to that. So some of the common treatment procedures are like Svedana, Vamana, Virechana and Vasti, especially Uttaravasti we used to advise, and also Kshalana in order to eradicate the infections, because pelvic inflammatory disease is also one of the cause. So in order to improve the uterine functions, so these procedures can be advised. And also there are a lot of medicines which can be selected as a drug of choice, like Amukura, like Shatavari, and also this gooseberries. These all drugs we can take. Amukura means Ashwagandha, Withania somnifera, and Ashoka, that is Saraca indica. These all are some of the drug of choice which we can select here. And the main thing is here we have to concentrate the medicine preparations. So medicine preparations like Ashoka Arishta, Kumari Asava, Saptasarangashaya, and also Pushyanaga Churna, Phalasarpis, Pushpadhanvarasam. There are a lot of medicines which promote fertility. So just you consult a physician and confirm what is the cause which you are facing for fertility in order to due to infertility. So according to that only you have to go for a treatment procedures. So these are some of the informations regarding female infertility causes and its Ayurvedic treatments. So I hope you all understood, and also please share this video and subscribe my channel. And also next time I'm going to come with a new topic, that is male infertility causes and its Ayurvedic treatments.